Nearly 500,000 U.S. children have tested positive for COVID-19 in the last 2 weeks, just as the school year is kicking off. The surge has some parents anxiously awaiting vaccine authorization for kids under 12, while others are pushing back against COVID protocols. Stephanie Ramos has more.
This morning, as children return to school across the country, pediatric COVID cases are reaching alarming heights. In the last week, children accounted for nearly 30% of COVID cases. Staff shortages due to COVID already pushing Massachusetts Governor Charlie Baker to call on the National Guard to help drive school buses. The test now, how to handle infections in the classroom.
Union County Public Schools employees, staff, nurses, halt all activity of contact tracing.
In one North Carolina school district, the school board voting to allow students and faculty to return to class, even if they have been in close contact with someone who tested positive for COVID. Only those with symptoms or a positive test are required to isolate. Ahead of the announcement, the same district reporting nearly 7,300 students and staff were in quarantine last week. Only 479 students tested positive. The move coming after mounting contact tracing pushback from parents.
I'm the parent. I can decide when my child can quarantine, and I'm going to decide that.
But not all agree.
Right now, it seems very reckless for them to be eliminating quarantines and contact tracing at the school level. It just doesn't feel like a safe environment for the kids.
The debate playing out as many parents anxiously.
All right, Stephanie Ramos, thanks for that. And I'd like to bring in emergency medical physician, ABC News medical contributor, Dr. Darian Sutton, for more on this rise in pediatric COVID cases. Dr. Sutton, thanks so much for being here. Last week, we heard that kids accounted for 30% now, nearly 30% of all the COVID cases in the U.S. And that was before you saw large districts like here in New York City going back to school. So how do we curb this trend with the start of the school year?
Unfortunately, this is something that is to be expected, as the Delta variant is proving more transmissible and targeting those who are unvaccinated, which unfortunately are children. Ways to combat this is to use mitigation efforts. That includes vaccinating all of those who are surrounding children, making sure that we use mitigation efforts in schools, such as distancing when possible, contact tracing, and again, vaccinating all eligible staff members. These are ways that we can use to reduce the risk of transmitting COVID-19 from one child to another. And it has shown to be effective when we look at studies that have recently been done and been done prior in the pandemic, especially within New York City.
All right, as someone who just sent my own son into those classrooms, I certainly hope those mitigation efforts will work. There has been some disagreement, though, among experts when it comes to booster shots. You had two regulatory officials who are leaving the FDA saying that in an opinion piece that it's too soon, they think, to recommend boosters for the general population, but the FDA says that that's not the agency's position. So what's your take on that?
I understand both sides to this argument. On one hand, you have a group that states that we simply do not need a booster shot, and I understand where that comes from. Most recently, as of September 7th, as reported by the CDC, more than 176 million people have been vaccinated, and of those, only 14,000 required sustained a breakthrough case and required hospitalization or died. And that percent of the 176 million is very small, so it's proving to show that vaccines are continuing to be effective. Although those who are breaking through are high risk, and by that I mean those who are elderly patients and patients who are immune suppressed or immune compromised. And so I understand why we would want to use boosters, especially on high risk populations. Now, the other side of the argument is, why don't we prevent as much as possible? In the setting that we have availability of the vaccine, I also understand that argument, but both of these arguments can't distract from the main issue, which is that the unvaccinated are the main causes of transmission, hospitalizations, and deaths. So I want to focus on vaccinating those who have never received a shot at all.
And the UK is now preparing to become the first country to administer mix and match booster vaccines, where if you got one kind of vaccine, you might get a different one as your booster. Do you think we'll see the same in the U.S.?
I think so. And I have to say that this is one of the main questions I've been getting. Many people who say, I've gotten Moderna, Pfizer, or Johnson & Johnson, and can I get a different vaccine? There is no reason to believe that you can't mix and match. But the question that we have as physicians and scientists is, what is the exact benefit? COVID, and those are the studies that we're eagerly waiting for the results on.
Now, in better news, Broadway shows are coming back here in New York City. We've got Hamilton and The Lion King, just two musicals that are reopening today. The city's indoor vaccine mandate also went into effect, I think just yesterday, this week. So they started enforcing it. So what are you looking out for with this combination as the city implements these new rules, but also reopens venues that are pretty crowded, like Broadway theaters?
Yes, I'm very excited about this opening of Broadway theaters, but I have to have a sense of caution, especially in the setting of the Delta variant. I do think that providing rigorous methods, such as requiring vaccines to be indoors, is very important because that substantially reduces one's risk of getting infected and therefore transmitting the virus. I think coupling that with other mitigation efforts like ventilation and masking can keep our numbers low, but we also have to use surveillance testing to make sure that we identify outbreaks before they become a problem.
All right, Dr. Sutton, always great to have you, and especially great to have you actually here in the flesh in studio. We appreciate it.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.